Anesthesia made surgery possible. Infection made it deadly. In 1860s hospitals, up to 50% of surgical patients died of postoperative infection, wound fever, hospital gangrene, septicemia. Surgeons wore their street clothes. They were proud of the crusted blood on their coats, proof of experience. No one knew the coats were killing patients. Hospital wards were death traps. Infection spread from patient to patient. Surgeons moved directly from one operation to the next. Wounds were probed with unwashed fingers. Dressings were reused. The mortality rate in the best hospitals in Europe was comparable to battlefield wounds. More patients died of hospital infection than of the operations themselves. Joseph Lister read Pasteur's work on fermentation and putrefaction in 1865. He made the connection immediately. If decomposition was caused by microorganisms from the air, then surgical wound infection was caused the same way. Block the microorganisms from reaching the wound and you would prevent infection. Germ theory gave him a mechanism. He needed a chemical. Lister chose carbolic acid, already used to treat sewage in Carlisle, as his antiseptic. He developed a spray that bathed the surgical site and the surrounding air during operations. The smell was overpowering. Surgeons and students complained. But the results were undeniable. Wound infections dropped dramatically. Patients who would have died recovered. Lister's first major case was James Greenlees, an 11-year-old boy with a compound fracture, bone breaking through skin, virtually a death sentence in 1865. Lister cleaned the wound with carbolic acid, applied carbolic-soaked dressings, and waited. The wound healed without infection. Lister reported the case and began a systematic trial. The evidence accumulated quickly. Lister published his results in The Lancet in 1867. In the 2 years before his antiseptic technique, 11 of 35 amputation patients in his ward died of infection. In the 4 years after, only 6 of 40 died, and those deaths were from other causes. The reduction was not subtle. Anyone who looked at the data could see it. Many chose not to look. Lister was initially dismissed by much of British medicine. He found his most enthusiastic early adopters in Germany. Richard von Volkmann and Ernst von Bergmann adopted his methods in the 1870s. German surgical mortality rates plummeted. The Franco-Prussian War of 1870 showed German field surgeons using Listerian antisepsis with dramatically better outcomes than the French. War tested the method and vindicated it. British medicine eventually capitulated to the evidence. When Lister moved to King's College Hospital in London in 1877, his technique spread through the teaching system. A generation of surgeons trained in antiseptic practice. By the 1880s, the carbolic spray was standard. Postoperative infection ceased to be the expected outcome of surgery. Florence Nightingale had reduced infection mortality in Crimean hospitals by introducing sanitation, clean wards, fresh air, clean water, proper sewage, before germ theory existed. She used statistical methods to prove her case, inventing the polar area diagram to visualize infection data. She did not know about germs. But she understood that cleanliness saved lives. Lister gave the mechanism she had already proven empirically. The carbolic spray was a transitional technology. By the 1890s, surgeons moved from antisepsis, killing germs, to asepsis, excluding them entirely. Steam sterilization of instruments. Rubber gloves, introduced by William Halsted. Sterile gowns and drapes. The goal was not to kill microorganisms that had entered the wound but to prevent them entering at all. The results were even better. The modern operating theater is the direct descendant of Lister's carbolic spray. Every element, sterile instruments, gloved hands, gowns, masks, filtered air, sterile drapes, limited access, exists for the same reason Lister's spray existed, to prevent microorganisms from reaching a wound. The principle has not changed. The execution has become total. Before Lister, 50% of surgical patients died of infection. Today, post-operative infection rates in well-equipped hospitals are typically below 2%. This reduction, from 1 in 2 to 1 in 50, is the result of antiseptic and aseptic principles that trace directly to Glasgow in 1865. Lister's contribution to human survival may be the largest of any individual in the 19th century. From filthy wards killing half their patients, to Lister reading Pasteur and making the connection, to carbolic acid spray over operating tables, to mortality charts showing the dramatic fall, to modern sterile theaters where infection is the exception. Antisepsis turned surgery from a gamble into a reliable intervention. I am Takku. Lister connected invisible microbes to surgical death, and clean hands began saving millions. Subscribe to Wisdom of Takku, because the simplest insights carry the deepest consequences.